bizarre. In this week's Bondi Vet Compilation,
Wow. Oh my God. Look at that.
prepare yourself for the stinkiest,
It smells. Oh, wow, that is rank.
the slimiest,
There's just all this pus everywhere.
and the most oddly satisfying
Oh my God, it's still coming.
extractions ever. Hate pops or love them, you won't be able to look away.
Everyone ready for this? Because I don't know what's going to come out.
At the Isleworth practice, Zoe is arriving with the school chicken, and Scott and vet nurse Reagan are waiting.
Hello.
Hello, honey.
Hiya. I got a chicken in a box for you. Do you want to see it?
Yeah. Hello. Oh, hello, gorgeous.
Check her out. Look. I got it right. It is definitely a chicken.
Does she have a name?
Jane.
Jane the chicken.
Jane the chicken, of course.
Jane. Oh.
She's beautiful, though, isn't her?
Do you know
Look
a
at
Jane?
her plumage.
I do know a Jane. My mum's called Jane.
This one's full of front. I don't know about your mother. I'm talking about this one.
Right. She's big up top.
Big up top.
Right.
Yeah.
Okay, well, it sounds like she needs some support, both physically and veterinarily.
Yeah,
Yeah,
that word. Yeah.
So glad I brought it to you. Brilliant. Full of confidence. Should we go through the console?
Yes, let's go.
I can't believe here I am bringing chicks to see my husband, hey? But I know he'll be able to help this one. Feel that.
Let's have a little feel.
What a massive bag of, well, crop.
Oh my
that
word,
huge?
that is bizarre.
I know,
isn't
it's
it?
mad, huh?
My goodness, the crop that she has, that sort of storage area for food, is absolutely massive. It's a handful of grit. It's astounding.
But within that, what you can feel is obviously food, because the crop is there to basically hold food before it goes further down the gastrointestinal tract. It's kind of like the larder cupboard of the chicken, really.
Okay.
But actually behind that, there's a thick, like, web of something. So this crop has become impacted with something. It's continued to fill, it's stretched, and now it's actually falling over her breastbone. And so it's just not emptying normally the way that it should. So what we need to do is actually X-ray and just see exactly what lies beneath. And if it's large enough, we're going to have to go in and perform surgery.
This chicken is going through something right now. It's uncomfortable for her, and she's about to go through an X-ray, most likely surgery.
Say bye.
So you can feel that element of pressure. Like the kids are waiting for this chicken to come back all well and fixed by Scott. So yeah, that's a bit of pressure for him there.
Hi, guys.
Hi. Hi.
Reagan and vet Tina will be assisting Scott.
What is that?
I know.
Hey?
Isn't that the most massive crop you've ever felt on a chicken in your entire life?
Very big. Let's check her weight. Hey, big girl.
Can we weigh you,
That's pretty
sweetheart? Good girl. Okay, so at the moment, you're about 2.47 kilograms of chicken.
Come on, Jane. Let's go get some pictures.
Let's go and X-ray a chicken. Unfortunately, Jane's condition literally won't right itself. And already today, I can feel that her crop is warmer, so it's starting to ferment. That will make this girl really unwell. And if we don't do anything, it could eventually lead to her death. Okay, stay still, Jane. X-ray. As you can see, a lot of material. That's very likely to be grit, which is absolutely normal. But what you can't see on here is what I can feel in the crop of Jane. So it's a little bit like a block drain, I suppose, in that what we've got is this sort of thick mat of, feels like fibrous material. It could be hay, it could be grass. And that's meaning that the food isn't passing through, it's remaining in the crop. The crop is stretching, and then therefore food stays in there longer. It stretches more, so it's a little bit of a deteriorating cycle. So all of that needs to come out. Unfortunately, we do need to perform surgery. And the interesting thing is I think an anaesthetic is probably even more risky. So I think it's far better that we just try and do this while she's conscious. Birds don't do very well under anaesthetic. They're quite prone to stress. But also, unfortunately, with this particular condition, she could regurgitate during the surgery and then breathe that in, get aspiration pneumonia and die. So there's lots of major risks, and all of them can be reduced by performing the surgery conscious.
Does that mean a local anaesthetic then?
Yeah.
Luckily, she's quite a relaxed chicken, so hopefully
Yeah.
she'll sit quite still for you.
Yeah, she seems very good, doesn't she? Okay. Well, let's get to work. I'm just going to pluck this first. First, we have to pluck poor Jane's crop, and then I give her the local anaesthetic, which is going to sting a little bit. But she seems to be taking it in a stride. She seems quite calm and quite relaxed, but who knows how she's going to react when I start to cut. She's a little stressed.
I know.
Okay. Right. Everyone ready for this, because I don't know what's going to come out. I also don't know how she's going to respond, but it needs to be done. It feels very strange to have my patient looking at me whilst I'm doing this sort of thing.
Hey, Jane.
Okay, guys, so I'm going to go into the crop now. So expect a really appalling smell.
Oh.
Okay. Jane has an impacted crop, so basically what I believe is that she's eaten something that she shouldn't, like long grass, that slowed down the transit of food down into her gastrointestinal tract, and it means that I need to go in and get it out. Oh, man, that's rancid.
Oh.
Look at all this stuff in here. Oh, my God. It's not nice. There we go. Here's the big thing. Wow. This is what I could feel. That is the problem right there. Oh, that is grim.
Jane, how are you still alive, my love?
How is she still alive? Look at that.
Oh, my God.
Oh, my God, it's still coming. Oh, my God. Oh.
That's disgusting.
Oh, that smells. Oh, wow, that is rank.
All right, Jane.
Good girl.
Oh.
Jane's crop was full of really long grass, which has probably been building up over months, and it started to ferment, and it's giving off a gas, which leads to a really rancid stench. So if we can stop her access to that, then we might not have this issue come back.
I can't believe how amazing she's been.
Yeah. What I want to do now, Reagan, is just give it a bit of a flush, and then I'm going to start to close. Extraordinary.
She's actually watching.
That's off-putting. Yeah. The bizarre thing about performing a conscious surgery on an animal is that they can look at you while you're doing it. And Jane has her beady eyes literally set on me, and it does make her quiver a little bit because it's an incredibly gruesome surgery, but she's taking it like a trooper. She's amazing, isn't she? I don't think I'll ever look at a chicken the same way again.
No, she's very, very brave.
There we go. And that is our first conscious chicken crop impaction surgery.
Are you
Done.
picking? Should we see how much she weighs quickly?
Yes, that's a great idea. Jane's pre-surgery weigh-in, she weighed 2.47 kilograms, but after removing a huge amount of muck from her crop, I'm really interested to see what she weighs now. Okay, the moment of truth. Yeah, all right, yeah, good girl.
Good girl.
So she's 2.235, so over 200 grams
Yeah.
of grossness
Of yuckiness.
removed from your crop, eh?
Now you look like a normal chicken again.
200 grams might not sound like a lot, but for a chicken like Jane, it's 10% of her body weight, which is massive, and it really will make a difference to her comfort levels now it's out. Here we go. There you go. All right. Yeah, you're gonna feel so much better. Because Jane's crop was distended for so long, it's become very stretched and very baggy, and even after the surgery, that isn't going to improve. So I do need to find a way to help to manage that so that she never suffers with crop impaction again. Gonna need to talk a little bit about support, aren't we, eh? Stop that crop from filling up like that again. Morning, Jane. Hello, baby. Hello. Good morning to you. Bright and happy, very talkative this morning. Come on then.
Next morning in Isleworth, Jane, the school chicken, has recovered well after the unusual procedure to clear a massive blockage in her crop.
Yeah, happy girl this morning, aren't you? Eh?
Hello.
Hey.
Hiya.
Scott's wife Zoe has arrived to take Jane back to the school.
She looks fat.
Yeah, she's doing really, really well.
So when I first see Jane, it's very obvious the difference. Her crop, although still a floppy crop, for lack of a better phrase, it's a lot better than it was. And she's looking fabulous.
The only thing, however, is that because that crop was distended, was stretched for so long, unfortunately it is a little baggy and it will remain that way. So
That's a bit rude.
it's a little bit rude. I'm sorry, honey.
So she will forever have a floppy crop.
She will.
What happens now is that every time she eats, Jane's crop is going to fill up, it's going to hang over her breastbone. It means that the food won't transit through her gastrointestinal tract as it should, and unfortunately this will mean an ongoing issue for Jane.
Also, you can see her posture's affected. If I provide a little bit of support, you can see she immediately stands up. So what we need to do is something that I have never done before. I have never prescribed said treatment, and it sounds like I've made it up, but I haven't. It's a crop bra. A lot of ladies that might be quite well endowed in the front department,
Right.
they need support. So what I've ended up doing is doing a little bit of sort of like, you know, primary school craft work, where I've used one of our surgical masks and attached it then to a little bit of padding here and sort of special support of the crop just in the centre there. It feels like we're on an infomercial.
It's very lightweight, very supportive, and very attractive.
Call 0800 chicken bra.
Of all the random stories that Scotty has told me about things he's had to do to assist animals in their welfare, a chicken bra, I think, probably is the weirdest.
So that's where your crop is. So you just
Yeah.
want to go underneath there
Okay.
and then hold it. So what we're going to do is place one around her neck, okay? And then the other
Lovely.
one goes underneath the wings.
Okay.
So that's just going to support that crop,
Okay.
keep it up, keep this girl eating and happy.
Oh my goodness.
Happy.
All those years in vet college, and this is what it's come to.
Yeah, putting a bra on a chicken. I've arrived.
I'm really glad to have been able to help Jane, and even though I've given her a rather amusing bit of clothing to wear, I hope that her flock will accept her for who she is, a lovely girl that just needs a bit of support.
I now have to go and explain this to a school.
Yes.
As to why the chicken is wearing a bra.
But think of it this way, is that you only have to explain it to the teachers have to explain it to the kids.
Billy. Billy.
Bello, a Cavalier King Charles Spaniel, has suddenly collapsed and been rushed into the Bondi Referral Hospital, SASH.
All of a sudden, he just lied on the kitchen floor, couldn't focus, his head tilted to one side, and he just couldn't stand up. He was just like going in circles. It was very upsetting.
Glenda and her daughter-in-law, Georgia, are fearing the worst.
My initial thought was he had a stroke. It looked like a human that had had a stroke.
Bring him through.
Emergency vet Dr. Lisa Chimes needs to urgently assess the 6-year-old.
Hey, honey, your world's upside down. What's happened?
He just went down, his eyes started flickering, and he just couldn't stand. He couldn't, like he was all over the place.
So what we really need to do now is work out, is this a problem going on in his brain?
Yep.
Or is this a problem going on outside of his brain?
Right.
So somewhere like in the ears?
Yep.
Okay, so I'm just gonna pop him on the floor, see what he can do.
Come here, baby. Oh, come here, baby. Hello, come here.
There's something going on with Bello that is affecting the nerve that's controlling his balance.
He's not too steady at all.
There's a whole variety of things it could be, and we need to do some more tests to work out why. So I'm gonna have a look inside his ears, see if there's any problems there. That one looks pretty good. So his ears look actually pretty clean. There's no inflammation, there's nothing I can see down that ear canal that's causing any issues. That doesn't necessarily rule out ear problems, okay? Because I'm just looking at the outside ear
not,
canal.
you know.
Exactly.
Bello will now undergo a CT scan to determine if the problem is within the inner ear or the brain.
Hey, what's going on?
Problems inside the brain could be something like a stroke, something like a tumour in his brain, some sort of inflammatory disease in his brain.
Just getting better. Very nerve-wracking, yeah.
All right.
Just hope it doesn't turn out to be the worst.
Honey, I know you're dizzy. You're dizzy. The worst case scenario would be that Bello's got a brain tumour, and I really, really hope that's not something I'm going to have to tell Glenda. All right, honey.
Bello's CT scan is underway at SASH.
Good boy, Bello. The causes of balance problems can be related to something inside the brain or something outside the brain. And what we really need to do with Bello is work out what's causing these signs.
Never seen him like that before.
Poor Belly.
It's a tense wait for owner Glenda and her daughter-in-law Georgia.
He is our baby. All our boys have grown up now and he's our little boy. Because he's never been away from us. Yeah, it's just that he's always been with us. Wherever we are, he is.
Well, that explains his signs. Okay, come through. So we've done the CT. His brain looks okay on the CT scan, so I think we are dealing with a primary middle ear problem, okay? The area behind the eardrums is filled with fluid, okay? It should be empty, and both sides are filled with fluid. I think Glenda is actually quite relieved to hear that Bello's got middle ear disease. She was so worried that it was going to be a brain problem.
Is it normal for a dog that's so healthy to get this, like, in 24 hours?
It can happen quickly, and you know, perhaps there was fluid in there and it was to a point, and he was coping, and then it just got too full, puts pressure on the nerves, and then bang, that's caused these signs. Okay, so next step would involve us actually taking him through to have a procedure done with one of our specialists. We're going to flush the ears and make them empty like how they should be. And I'll speak to you straight afterwards. Okay?
Thank you.
All right.
Thanks very much.
No problem. You take care.
Thank you.
Okay.
I am feeling relieved, but yeah, every procedure has concerns because you don't know what's going to happen. They're under a general. It'll be a long wait.
Just hold steady for a second. Pull it back.
At SASH, Lisa is working with dermatologist Dr. Philippa Ravens to unblock 6-year-old Bello's ears.
So what I think we're going to do now is see if we can make a little hole in that eardrum and try and drain it. Really tenacious bit.
When we make that first puncture in Bello's eardrum, what comes out is just this thick material. The middle ears should not have any fluid in them. They should be filled with air, and Bello's middle ears are just packed with this thick, slimy mucus. We're flushing out all that muck, and hopefully that's going to relieve the pressure on his nerves and improve his balance. That must be so painful.
So see, go in a bit, a bit more. We might actually just need to break it off piece by piece.
Look at that, that is so thick.
Oh, wow.
Oh my God.
Look at that.
Seriously.
Wow,
that's
a lot of mucus. Well done, team.
Lovely.
I think we've pretty much got most of it out, but sometimes there's just a little bit of mucus. Certainly, I think he was towards the more extreme end.
It will be interesting to see how quickly he recovers. Some dogs get better as soon as they wake up from the anaesthetic, and some take a few more days. But no doubt he will be feeling instant relief. I think he's pretty comfy now, snoring away. You got some relief, huh, buddy? You just have a good snooze. Bello, you want to come out?
Next day, Lisa is ready to release Bello.
Good boy, Bello.
Although it will take some time for his balance nerve to fully recover.
He was so dizzy. He was experiencing signs like people with vertigo. It was like he was in a washing machine, roller coaster, spinning around, and just had no control of it. Good boy, Bello. He is strutting his stuff, wagging his tail. He is a different dog to what he was when he came in.
Glenda and her son Matthew are waiting to take their beloved Cavalier home.
I was very relieved it wasn't a brain tumour. and it came out to be the mucus in the ears.
You want to go see Mum? Should we go? Let's go. Come on.
I think we're going to have to give him a lot of TLC. He's going to have a lot of love and care.
Look who's there.
I'm going to start crying.
Look who's there.
No. Oh, he looks so much better.
He's walking and he's wagging his tail and he's happy.
He's so much better. Kiss, 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 kiss. Oh, yes. We've missed kisses. Yes, we have. Haven't we? Compared to when we brought him in. It's amazing. Sorry, I'm emotional.
No, you're allowed to be emotional. This is a pretty traumatic thing.
It is. To go from healthy to being that sick, and now he's sort of bounced back.
Yeah.
It's so good.
That was a delightful reunion. Glenda was so emotional. I didn't think she had any idea that Bello would be this good.
This is overwhelming.
What else do you got? Come on, what else?
What about the back? What, the horse area?
Oh, yeah, we got one of those as well.
One of those at Bondi?
Yeah, you bet. All right, and now you're just showing off, aren't you?
Yes.
What do you got here?
Nice little girl, little Kelly.
Kelly's leg was broken after being hit by a car.
Last week we popped the plate on the broken femur and fixed it up, so we're trying to rehab her and get her back into the wild eventually.
You get pretty much everything around here, don't you?
We certainly do, and speaking of everything, I've actually got a little job lined up for you. We've been saving it. In fact, I saved it specifically for you.
This doesn't sound good at all. What do you got? What do you got?
We've got a little bonnet macaque, Ziggy, out at the zoo. He's got a couple of little problems, got a couple of little lumps on his eye.
A monkey.
Monkey.
There's no monkey.
Well, you know, we get these city blokes come out to the country. I reckon they can show us a few tricks, so we've got to put them through a little bit of a test.
Call us when you're done.
Yes, righto.
We'll see how he goes.
The more I think about it, the more I'm starting to think that Andrew has really stitched me up here. Monkeys, sure, they're funny, but they're notoriously difficult to catch because they're intelligent. This is going to be really tricky.
That tickles.
It's part of the welcoming committee here, is it?
Yeah.
In the last week, owners of the
What level
Mansfield
were you?
Zoo, Bronwyn and
You reckon
Dave,
about here?
have
No,
become
on edge.
increasingly concerned about Ziggy.
He's got some little lumps on his eyes. They've been there for quite a long time, but just recently they've got really large, and it's just got to the point where we need to get them looked at because they're going to start impacting on his vision and possibly on his eyes as well.
The really frustrating thing for me is that I can't go in there with him. Monkeys carry a lot of diseases that are transmissible to humans, so if I get in there and he bites me or scratches me, then I could leave Mansfield with herpes.
Zig, come on. So the whole idea here is to make Zig a little bit jealous of the food going on here, so he's going to come down a bit closer for us.
Hopefully, yes.
He's looking down to almost taste it. He really wants it.
Ziggy's favourite foods are only managing to get the attention of his neighbours.
It's pretty clear I'm being outsmarted by a monkey right now.
It's time for Plan B. The eggs and almonds are now placed in the capture cage.
Come on, mate.
Hopefully Ziggy will come down and take the bait.
He went halfway in and then ran out.
Oh. Serious?
He's in. Yeah. Now I can actually get a really good look at Ziggy's face. It's amazing how big those lumps are. My initial thought was that maybe they're cysts that have grown out from his skin there, but they could also be papilloma, so warts, or it could be a type of tumour. It's hard to know right now without actually getting in there and taking them off and getting the samples analysed.
Back at the clinic, Andrew's waiting for news on Ziggy's capture.
How'd you go, mate?
It was pretty simple.
Yeah, good. I was wondering who's going to win the battle.
It's very one-sided. I'll tell you the true story later on.
Okay, then.
The hard part about operating on Ziggy is the fact he has so many of these lumps, and they're also in a very sensitive area. If these were to get any bigger, or if there were to be any more of them, the surgery would be nearly impossible. This is about the last possible moment we can do it, and do it safely.
Chris is using a probe with an electric current running through it to burn off the lumps. The electrocauterisation helps minimise any bleeding.
Now we're up close to it, you can see definitely. There's some quite serious irritation. There's extra pigmentation and extra coloration around the eye. There it is there. The really interesting thing I'm noticing when I'm taking these lumps off is the fact they're not really that deeply invading into Ziggy's eyelid. Normally tumours will quite aggressively push their way into the body, whereas warts and cysts generally don't. I think that's a good sign.
We've taken off 4 already and you can already see a pretty dramatic difference. The tricky thing now is how much more do you do? You take off too many, you're going to cause a lot of irritation, a lot of inflammation. It may not be necessary. I think Ziggy's going to have to live with a few little lumps and he'll get by with that. I think as long as they're not starting to rub in his eye or block his vision, he's going to be okay. Zig, you actually look a lot better, don't you?
It's actually pretty awesome to see a monkey this close and do something to help him as well. It's a pretty cool experience.
Ziggy's biopsies will be sent to the lab to be tested. For now, the monkey will be kept at the clinic for observation as he tries to shake off that surgical hangover.
You know that feeling you sometimes get when you wake up in a hotel room and you don't really know where you are? Ziggy's going to get that times by about 100. It's going to be really confusing and quite confronting for him to all of a sudden look around here and have no idea where he is.
So I'm relieved to see you doing this. There was a period of time where I thought you actually get no time off at all.
Occasionally we do. There's got to be some perks to living up in this beautiful area.
It's been a challenging week in the bush, but Chris's tour of duty is now over.
It's nice out here. It is. Just need some sand and maybe a few waves, and the water needs to be warmer as well.
It's not Bondi, mate.
It's not Bondi. Got to ask though, mate, would you have me back?
Anytime, mate. Anytime. Always welcome back.
You mean it?
I do. Well, somebody's got to check the monkey again. Ziggy.
Oh, Ziggy.
Talking of Ziggy, it's good news. The monkey is back home and his tests are all clear.
Really pleased. And the fact that his eyes are much bigger and brighter. It's a bit of plastic surgery, works marvels.
All right, buddy, well, let's take a look at you. Hey, you're a good boy. You've been to the vets lots of times, haven't you? Too many. That's right.
At SASH, Lisa is examining Angus. The 5-year-old has swallowed a soft toy and Lisa is worried that it could be lodged in his esophagus.
He actually looks pretty normal, and that's because his owners have really been on the ball and brought him in as soon as they noticed that there was anything wrong, which means that at the moment it's probably not causing an obstruction, but with time it's got the potential to become quite stuck. What I recommend we do now is take an x-ray of Angus's chest, because I want to have a look at his esophagus and make sure that that toy is not sitting in there, because if it is, then we're going to have to pull it out with an endoscopy. But if it's not in the esophagus and it's moved already into his stomach, then we really have 3 options. Now, the first one is to make him vomit, and hopefully he'll bring it up the way that it went down. Option 2 would be to perform an endoscopy and try and pull the toy out that way. And the third option would be doing nothing and waiting and seeing if he passes it. But it could get stuck. And if it gets stuck and causes an obstruction, then that can be life-threatening. You know, it could perforate through his bowel and that can cause peritonitis. That's potentially fatal, would need emergency surgery. It's one of those things that I just can't guarantee which way it's going to go. So those are the options, and you guys are going to have to decide what you want to do.
Whatever you suggest, whatever you think is the best option.
Yeah.
Because it's not worth the risk to wait, I don't think.
Yeah.
Angus's future now depends on the results of X-rays and just where the toy has ended up.
Hopefully we'll get some information from it, and then I'm going to try and make him vomit if the x-ray is normal, and then fingers crossed that I get another one of these out.
Excellent.
It's brown in colour if that's of any help.
Good to know. Won't be long. Come on, Angus, this way, buddy. Let's go. Angus has been through so much with his epilepsy and his seizures, and they've all been in and out of hospital, and now he's here again with a toy stuck that could be life-threatening. We need to get this toy out very quickly for Angus's sake and for theirs. The x-ray showed that the soft toy is unlikely to be in his esophagus, so it's more likely that it's in his stomach. What we're going to do now is we're going to try and make Angus vomit so that the fluffy toy comes out in the easiest way possible. Now, I need to feed him a big meal, so that he's got something to coat that toy when he vomits it up. This is as spoiled as they come.
Are you excited?
There you go, Angus. That is delicious.
Angus will now get a shot of apomorphine to make him vomit.
Hey, bud, you're gonna feel a bit sick now, and I'm really sorry about that. Here comes the drooling.
There we go. This is what happens when you eat your toys. All right. You get to be sick.
I'm really hoping that Angus vomits up this fluffy toy, because if he doesn't, we're going to have to give him an anaesthetic and perform an endoscopy to try and pull it out.
He's really not feeling well. Good boy. Come on. Good on my buddy. Oh, I'm a bit worried now, because that's a lot of food and there's no toy in there.
Angus has vomited a couple of times, and as I'm searching through this stinky vomit, there is no sign of pet, which means that Angus has to have an anaesthetic so that we can try and pull out the toy with an endoscopy.
Hey, I'm so sorry. Hey, bud, we gotta get that toy out.
Dr. Vibeke Russell has the tricky job of trying to remove the soft toy in Angus's stomach.
Hey, bud, you're gonna be all right. We're gonna get this out of you, hey?
We're just anaesthetising Angus now. We're gonna put a camera down his esophagus, his food pipe, to try and see if that toy is in his stomach, and hopefully we'll be able to grab it out and pull it out his mouth, because if we can't get it out and it's in there, he's gonna have to have surgery.
So we're going down into the stomach now. It's not looking hopeful. I don't see...
I mean, it would be pretty obvious if it was in there.
Yeah, this is a fairly small ball of food and I don't see any soft toy there, which is disappointing.
Come on, Angus. It's not a tiny toy. It shouldn't be this difficult. Really.
The frustration is building as the minutes tick by and there is no sign of the stuffed toy.
At the moment, things are looking a little bit worrying, and I don't even know if the toy's in there.
After more than 25 minutes, Lisa and the team are almost ready to give up and take Angus to surgery.
We're looking around and we're really not having any luck finding the toy. We're finding bits of food, bits of hairs. It's all just a big chaotic mess in that stomach.
Oh, what's that?
Oh, what is that? Looks a bit non-food-like.
Doesn't non-food-like?
I wonder if that is the tag. I think you got it, Vee.
Well, it's just... So we just have to go very slowly.
Come on, please be there. That looks like a toy.
Yep.
Yeah. Oh! Maybe those sardines weren't such a good idea, Mark. Oh, that's a job well done, I think. That is a huge relief. We managed to get the fluffy toy out of Angus's stomach with the endoscopy, which means no surgery for Angus, and after a little bit of recovery time, he'll be home ready to take his medication. Hey, buddy. Angus, do you want to go home?
You're all ready to go home. Come on, buddy.
Later that afternoon at Sash, sheepish toy eater Angus is ready to go home.
Hey, you can't live without your friend. The procedure's gone really well. Angus has recovered and now his family are here to pick him up and take Angus and Pet home in time for dinner and Angus's medication. Come on, buddy, let's go. Come on.
Relieved owners Tracy and Ray are waiting in reception.
We are looking forward to getting him home and just wait for the next episode of what he gets up to.
Come on, Angus. What's around the corner? Hey.
Yeah, we're over here.
Angus, there.
Hello. Hello.
I'm really glad that Angus is okay. He's a pretty special dog. Like, they've saved his life once here before and pretty sure they've done it again this time.
All right, so here is your other pet. He's been shampooed, blow-dried a little bit, had the deluxe treatment. So I've spoken to Angus and told him that he needs to be nice to his pet.
To his pet.
So the rest is up to you guys. I've done my vet counselling and
Angus,
you have to mend this relationship.
what did you do with this?
We'll take Angus home now, give him a strong talking to, tell him that friends are not food, and then we'll give him his drugs and cheese, and hopefully everything will be fine.
Okay, thanks again, Lisa.
My pleasure. Take care. Bye, Angus.
Yeah,
Bye,
say bye.
Pet.
Come on, home time. Good boy.
Three hours south of Sydney, mobile vet Alison is on her way to a very special appointment at the Possumwood Wildlife Sanctuary.
So excited today. It's a huge day. We're going to Possumwood and Bungadore, and we're going to surprise Audrey, my twin, who I haven't seen for 5 months. So it's been a really, really tough 5 months.
COVID-19 state border closures have kept Alison and her twin sister Audrey apart. But with restrictions now easing, Alison's planning a surprise visit, just in time for the opening of the sanctuary's new animal hospital.
I can hardly contain my excitement. I haven't seen her. Just want to give her a big hug. And then doing the stuff that we love at Possumwood. So excited to see everyone.
Meanwhile, Audrey is already at Possumwood and is checking out the new facilities she's helped to build with owners Rosemary and Steve.
This is the waiting room.
Yeah, this is the waiting room. Air conditioning in all the rooms.
Yes. Wow. What I love about Audrey is that she's really driven. It was back in the bushfires that we discovered Possumwood and started helping out the roos in the area, and since then she hasn't stopped. She's continued her passion. You know, she's now helping Steve and Rosemary set up this wildlife hospital in the sanctuary to prepare for the next bushfires. How beautiful is this view? I have missed this place. Got my coffee, water for the day, and some presents for lovely Rosemary and Steve. So excited! Being an identical twin, you are the other half of each other, and it's been really hard being separated because it feels like I've lost one half of me.
I haven't unpacked all of that stuff yet.
And then this is the surgery. So when I finally see Audrey, what are you doing here? Oh my God! It's like so familiar but almost not real because I haven't actually been able to touch or feel her for the last 5 months. What is going on? Really?
When she came around that corner, I just fell to the floor and it was just the biggest shock of my life. I was so happy, it was so emotional.
I thought you weren't coming.
You know, it's just been really tough, just personally, professionally, just not having her by my side. So her coming down, it meant the world.
I thought you weren't coming. That's so sad. Oh my God, there's so many cry. That's so embarrassing, I never cry. But it's also really weird because I feel like we haven't ever left each other. It's like things are just back to normal.
It's like when I see you, everything goes back to as if nothing happened.
Nothing happened. Back to business.
But with so many sick and injured kangaroos to treat, the hugs can't last forever.
And then there's another wall that comes from here to there.
The sisters' first task is to set up the hospital's brand new operating theatre.
A goes into B.
This new facility is almost like the finishing touch of my work. It also means that, you know, I can provide a service that's much better than what I've been doing. It's been a lot of planning. To see it finally finished today and all that equipment in there means the absolute world to me. And also to do it with Alison.
So we've almost got the surgery room all set up. We've got the anaesthetic and the IV fluids. We opened our brand new light, which is great. Got our ET tubes. So we're almost ready to go to treat our first surgical patient.
Longtime Possumwood resident Laurie has recently developed a worrying eye infection and needs urgent treatment.
Laurie's one of my favourite boys at the sanctuary, but we're really worried about his eye.
Oh, that looks nasty.
He's got a big swelling down there and his eye's weeping some pus, so I'm interested to go in, have a look and find out what's happening.
Just having a look in the eye, you can see all the conjunctiva, so that pink membrane is swollen and that third eyelid's actually coming across the eye. And there's just all this pus everywhere, so I'm just trying to figure out where the pus is coming from.
That infection is just collecting under the eye and potentially could spread into the bloodstream, which is dangerous.
So there's pus actually dripping up behind the tooth here, right under where that eye swelling is. The original plan was to have a look at the eye, find out where that swelling's coming from, and perhaps make an incision just under the eye to remove the abscess.
So it could be a tooth root abscess.
Oh yes. Later on, what we found looking in the mouth is that actually one of his teeth is wobbly.
Is there grass stuck in there?
Yeah, there is grass.
Yeah.
So when I'm fiddling around that cavity above the tooth, I actually find a big blade of grass. So I pull that out and flush through. Could be the grass that's causing the infection as well.
Yeah, it's trapped up. Massive grass.
The next step is to remove the tooth. Because it's wobbly and it's not healthy, we've got to get it out.
So that's what we do when I say we skin the tooth.
Okay, that's the other bit. And once we get it out, we've got this nice big open cavity that we can flush all that pus through. Looking at the tooth root area where I extracted the tooth, and all this pus is just coming out from that hole. So that kind of confirms that the infection's coming from that area.
That tooth came out really, really easily. Definitely that rotten tooth being out of the mouth is going to clear up that infection straight away. So good result, and that would have been very, very painful. Poor Laurie.
How's your eye feeling? I'm really happy with his progress. We'll come check on him a bit later.
With Laurie now safely recovering, the two sisters can finally have a moment to catch up.
I timed it perfectly.
And I was very, very surprised.
It just feels like normal to be back together. It feels like we haven't even missed 1 minute of 1 second of 1 day apart.
It is. It's really like that first 5 minutes. It was kind of surreal, and then I was like, "Is this happening?" And then straight after that, we went into work, and it was like, "Oh, she's been here the whole time." It's like you haven't even been
It's
away.
just like back to doing surgery together, back to treating our wounds together,
so
like we
weird.
never left. This was a dream.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.